Kirby, would you do the roll call?
Sure. Before I get into roll, just a reminder, we're continuing to meet virtually in order to keep everyone safe with the new variant that's going around with COVID. So we'll reassess next quarter to see where we're at. But right now, the council just determined it was safest for everyone to continue to meet that way. So with that being said, per the Open Meetings Act, this meeting is being recorded and it will be posted to the department website within the next day or two. So please make sure your phone, your computer is muted if you're not presenting to prevent any feedback. And please state your name when speaking or asking any questions, so it's helpful when capturing the minutes. I'm going to go ahead and do attendance quickly, and then I can hand it over back to you, Debbie. Okay. So like I said, this is Kirby 5 with the department. We have Amber Hampton on the call, Avis Easley, Debbie Hillen, Greg Keeling, Kristen Veloff with the department, Laura Durham, who's at TATIS physically. Thank you, Laura. Rama Mohammed, Rebecca Provost Emmons, who's with the department, Stephanie Hale, Wendy Sullivan, Zach Blair with the department, and there's another person who had called in. Can you state your name?
Patience Need with TMCA.
That's right. Welcome, and Patience Need with TMHCA. All right, Debbie.
All right. I'd like to again thank you all. I'd entertain a motion to approve the minutes that were sent out to you. Could I have a motion, please?
I make a motion.
Thank you, Amber. Second?
Laura Durham, I'll second.
Okay, thank you, Laura. All right. You know, many of you hear that there's a lot of money going into recovery courts and the importance that they play within our communities. And as I was thinking about the agenda, and I have the pleasure and honor of serving on the Recovery Court Advisory Board, and I've been involved in recovery courts in some fashion since 2000. So I definitely will age myself. But I called Rebecca. Rebecca is new into her position. And congratulations to you. It was a loss for us when Ellen passed away. It was a big loss, and it's been a big learning curve for everyone. But Rebecca has worked in recovery courts for many years. I met her when I first started getting into recovery courts, and she was in West Tennessee. And I tried not to hold that against her, that she was across that river. But Rebecca is now the Director of Criminal Justice Services. And I asked her, would she come and talk specifically to us about the recovery courts and the recovery courts in Region 5. So Rebecca, again, thank you. And I know you're on a timetable today, so we'll be respectful of that. So thank you.
Thank you, Debbie. So I'm honored and excited to be here with you guys. Debbie said she dated herself by saying she's been involved since 2000. I have been involved since 2001. So we're dating ourselves today with recovery courts. But I appreciate the invitation. Yes, I've been involved in recovery courts in a variety of capacities for the majority of my professional career. So while I am new to my role as Director of Criminal Justice Services, I'm not new to recovery courts. It's been my passion for almost 20 years. Well, 20 years. Wow. So thank you for having me. I am excited to talk to you guys a little bit about recovery courts, and I recognize some names here, and I recognize some of the names in the email that was sent out. So I know many of you here are already familiar with the amazing work of recovery courts and what we're doing. So just to give you guys kind of an overview and an update and entertain any questions that you have. I'll give you a brief overview of recovery courts, but I'll keep it brief because I think a lot of you guys do already know kind of how they're structured and the work that they do. But in Tennessee, we call them recovery courts. Across the country, they're known by a variety of different terms. Some places say drug courts. Some places say problem-solving courts. Some places say specialty courts. But in Tennessee, our department has chosen to call them recovery courts because we want to focus on recovery. So underneath the umbrella of recovery courts in Tennessee, we have what were drug courts, mental health courts, veterans treatment courts, family treatment courts. We have a handful of DUI courts and one human trafficking court in Davidson County. Now, not all of these programs that are in Tennessee are funded through our department. The majority of them are. But we do have a number of programs that have federal funding and that also have local support, which is pretty amazing. Recovery courts as a whole focus on serving nonviolent offenders who are at high risk for recidivism and who have a high need for treatment. They can have, for recovery courts, they can have substance use disorder, co-occurring disorder, mental health court. Mental health diagnosis would be the primary diagnosis for those individuals. As you all know, most people have a mixture of both. So it's determining which is primary and determining what type of services that they need. The charge, they have to have a criminal offense. This is a court program. So the offense does not have to be a drug. They don't have to be arrested for possession or for having drugs, but it has to be a drug-driven offense, which means that if you were convicted of theft, it's because you needed money to buy drugs, those types of things. So we try to establish a causal relationship. We try to establish a causal relationship between the offense and, the need for treatment. And one of the key things that really makes recovery courts different is that participants have to be willing to be involved in the program. They cannot, while they are court ordered, once they agree to do it, they do have to first agree. So it is voluntary. Recovery courts are considered long-term treatment in the sense that supports and treatments are provided for individuals throughout the duration of their time in the program. That's not to be confused with long-term residential treatment, but it's long-term treatment. They provide intensive supervision. They provide regular random drug testing. And the most important part about recovery courts, the most impactful part, and research supports this, is frequent court appearances in front of the judge to report out on their progress. Research shows that the judge is the most impactful part of a recovery court. And for those of you that have been and seen it, you know this. We have one of our judges in South Central Tennessee who, if you've done well throughout the week, they appear before him every other week, and he gives everyone a cookie if they've done well. And it may seem like a little thing, but every single graduate of that program that I've heard from is like, a judge gave me a cookie, and it's huge. And, it's about positive reinforcement. And again, research supports that positive reinforcement and that rewarding for, compliance is one of the most powerful parts of recovery courts as well. Try to always focus on the positive. Recovery courts also use a non-adversarial team approach. So on a recovery court team, you typically have a recovery court coordinator, case manager, a treatment provider, a public defender or defense attorney, prosecutor, and a judge. Oftentimes, there's also a law enforcement individual on the team as well, but that is the core team. And each week they come together to discuss each participant and support them and kind of determine, if they need a course correction or a treatment adjustment. But all of these people are at the table And for you treatment folks, I know you're very familiar with the staffing approach. That's what this is. They're staffing the case, talking about the client, what they need, where they need resources, how they're doing. Certainly the goal of recovery courts is to keep people out of jail and prison. We want to address the issues that are leading to their involvement in the justice system. We want to promote public safety. We want to bring families together. We want to increase societal accountability. And bottom line, we want to also save communities money, because keeping people out of the system and providing them with the treatment that they need so they don't become involved in the system again saves your community money. It saves our state money. And, we're really helping to get people to get their lives whole again. So I know that jail is extremely expensive. And so recovery court is a fabulous option to not only address fiscally, but to help people get back to where that involvement is not a part of their life. We have funding through a variety of different sources. We have dedicated state funding. So a lot of communities also supplement the state funding, which is amazing. We get discretionary federal grants that we're able to help use to support projects in certain areas. We currently have 82 recovery courts in Tennessee. We are continuing to grow. We got funding from the governor's budget this year, approximately $4.6 million to establish 2 residential recovery courts, one in West Tennessee and one in East Tennessee. And so we are working towards that. Approximately $2 million of that is one-time funding, but 2.6 is going to be recurring dollars to fund those projects. So we're excited about that. There will be an announcement of funding coming out. We'll let you know when that happens. And I could talk all day, but with that, if y'all have any questions or comments, please let me know.
Rebecca, do you know, and Rebecca sent me a link and I'll forward that out to everyone. But do you know how many recovery courts are actually in our region?
So I think I told you this on the phone, Debbie. I think in judicial districts and not in regions.
Yeah, I know.
So and I think you told me that, and I've got my map here. I don't know if you can
Oh,
see
good,
this.
because I was trying to find the one where I opened this morning.
So let's see. Our region is Central Tennessee minus Davidson.
That is correct.
Does that include South Central Tennessee as well?
It does.
So I'm going to kind of look at my map and kind of go through what I think is your region. I may include some that aren't, but we have recovery courts. We have 2. We have a veterans treatment court and a recovery court in Montgomery County. We have a recovery court in the 23rd Judicial District, which covers Houston, Humphreys, Dixon, and Cheatham. We have a recovery court in the 21st Judicial District, which is Williamson, Hickman, Perry, Lewis. We have a recovery court in the 22nd Judicial District, which is Murray, Wayne, Lawrence, and Giles. We have a brand new recovery court getting off the ground in the 17th Judicial District, which includes Lincoln, Marshall, Bedford, and Moore. We also have a misdemeanor program in Marshall County. We have a number of recovery courts in Rutherford County. They have a drug court, a mental health court, a veterans treatment court. Let's see, the 15th Judicial District, we have a recovery court that covers Wilson, Smith, Trousdale, and Macon. We have a recovery court in Robinson County, and we also have one recovery court and mental health court in Sumner County. And then we have
the 18th.
It is, yep. And then I don't know if y'all have the 13th Judicial District, but that is DeKalb, Putnam, White, Cumberland, and Warren, or not Warren. DeKalb, White, Cumberland, and Putnam, we have a recovery court there. And then Warren County as well, which is the 31st Judicial District. And then if you have any members from the 12th Judicial District, we have Franklin County, Grundy County, Sequatchie, Marion, and Bledsoe, and Ray.
What was that judicial district?
That's the 12th. It's South Central. It's just east of Lincoln County.
So it's Franklin County, right?
It's based out of Franklin County, but it covers Grundy, Marion, Sequatchie, Bledsoe, and Ray. I think that should be all of your region plus some.
All right. First of all, are there questions for Rebecca?
They're letting me off easy, Debbie.
Yeah, they're letting you off easy. I'm not going to let you off easy.
I know you won't.
What I do know is that, and you said it early on, was the judge is the key, and the judge is the key, and the fact that this is an add-on to what they already do, but the mere fact that you're able to see some progress there. And I think the one thing that I remember that I liked was you could always, and even still today with the ones that we deal with at Buffalo Valley, pick up the phone and call the coordinator and say, hey, Rebecca's acting squirrely. She's not showing up for meetings. I'm going to send her back. And to be able to work out with them what, not that I'm kicking Rebecca out, but that the judge needs to get her attention.
Mm-hmm.
And so that's that working relationship between the agencies that the courts are working with, whether it's a treatment center, whether it's a transitional housing program, whether it's some kind of recovery support services, there is that coordination, and that coordinator takes on a lot of responsibilities in making sure that the community is aware and to get the community involvement. So
yeah, that's a big core piece of what coordinators do is community outreach and engagement. And gosh, y'all know we have to leverage every single resource we can get our hands on. So, building those relationships to leverage not only our relationships with the treatment providers, which we couldn't do it without the treatment providers. Not only that, but also other community supports, the faith-based community, our local groups and Rotary clubs, and they're all so very important and vital to, again, they provide so many things for us. We have one program, actually in the 22nd Judicial District, Judge Allen, I know you know him, and they have leveraged a really strong relationship with their faith community, and there's a local church who once a month pre-COVID would provide a family dinner. And all of the participants and their families would be served dinner at the church, whether it's in the church gym or wherever, but would be served dinner by the church. The team would go and kind of mingle and just kind of connect. And during COVID, and I'm not sure if they've gone back to it, but they would do drive-through court in the church parking lot, and they would have boxed meals that they would give to each participant when they couldn't do the family meal. So it's just little things like that, and it allows the church to get involved and to really truly understand the population and to give back in a really meaningful way. So I love the creative partnerships that our coordinators forge. They're rock stars. They're absolute rock stars. And especially after this last year and a half, I'm just blown away by their creativity and their ingenuity and ability to adapt and overcome and just roll with it and still keep taking care of their clients and still keep serving. So yeah, they're amazing. I'm biased, but they're amazing.
You're biased. Well, I will tell you, just to add on, because you spoke of obviously the 22nd, and it'll affect the 22nd and the 21st. But I know the council here has heard me, and we did a presentation on our Project Rural Recovery, which is our mobile health clinic that we partnered with the department to do, and it rolls into Lawrence County. I think it's in Lawrence County on Thursdays, and Wayne County, Lewis County, Marshall County, and Perry County. But the other thing that we are adding as a part of the community is a certified peer recovery specialist to work specifically with the Department of Corrections. So again, more involvement, trying to make sure that we steer these clients in the right direction. And those are just added resources that's available. I'll be going to Lawrence County here within the next couple of weeks to bring my person down and to introduce them. But I also specifically am going to introduce the bus tomorrow, who works as a coordinator down there. Was a counselor for us. So I'm going to be working with her to make sure that if they have health needs, those health needs get met.
That's amazing. Again, we're leveraging our resources.
It is. Any other questions? Rebecca, thank you very much and for participating, and anything we can do to help you, don't ever hesitate to call.
Thank you. I appreciate being asked. I'm always excited to talk about this. And I thank you all for the important work that you're doing and for the support of our work as well. And I'm excited about ongoing continued relationships and excited about your new project as well.
All right. Thank you.
Thanks, everyone. I have to hop off. I have another meeting at 10, but thank you all.
Thank you.
Bye.
Okay. I believe I saw ZB on here. Zach. Zach is going to give us a legislative summary. Oh, and he's going to let us see his smiley face this morning.
Just for a couple minutes, and I'm going to shift right back so y'all don't have to. So, good morning, everybody. Happy to be with you this morning. First thing I would like to do, if y'all don't mind, is introduce Kristen Veloff. Debbie got a chance to meet Kristen a few weeks ago during legislative and executive call, but I wanted to introduce her to the region membership. Kristen has joined the department as our Assistant Director of Legislation and Rules, and comes to us from Tennessee Board of Regents, where she was the Assistant Vice Chancellor for Government Relations. And before that, Kristen and I were both on the legislative team at Department of Children's Services. So we've worked together in the past, and I was really excited to be able to get Kristen on our team here. And I'll let her say hello.
Good morning, everyone. I'm so excited to be here. I'm so excited to work with each and every one of you and get to know you. As Zach said, Zach kind of gave a little bit of my background, but I just want to say that if there's anything you need, please don't hesitate to reach out to me. I'm here to help in every way that I can, and I'm just excited to be here. And thank you so much. And I'll turn it back over to you, Zach.
Thank you, Kristen. Kristen will be taking over a lot of the communications back and forth that Kirby was originally doing for legislative proposals. So hopefully we'll be able to take some work off of Kirby's plate and make it to where y'all are interacting directly with the legislative team, and Kirby's not having to ask questions back and forth when we're asking you questions. So hopefully that'll make it a little easier, but we're excited to help. I'll apologize before I get started. One, for my voice. My allergies are wreaking havoc this morning. And then number two, my 70-pound German Shepherd doorbell likes to participate in my conference calls pretty regularly. So if you start hearing some barking, please forgive me as I try to settle him back down as I continue. I'm going to go ahead and share my screen. And I will once again look at Kristen, and she's nodding her head that she can see that it's up there, and we'll start with this first page. So as uh, other folks mentioned earlier, the legislative proposal, legislative summary for this year is posted on our website. So this document is available. I encourage people to use it on your computer, so you can click various links, so the bill link or the public chapter link to review the text. But obviously, I'm not going to go through all 12 pages in every bill on here, but I do have some highlights for bills that I'm hoping that you will be interested in, and hoping that they will be uh, very helpful to our conversation today. But if you have questions about other bills that are on there or something that I didn't discuss, please feel free to bring that up at any point while I'm presenting or at the end. We'll start out on, like I said, page 1, House Joint Resolution 175. Debbie and Rebecca just a few minutes ago mentioned the loss of Ellen Abbott, and the legislature, in a fitting tribute, decided to honor her with a joint resolution. So we thought it was very appropriate as well that we add. I think my screen went away. Is anybody seeing
I
my?
still see it.
Okay, good. Good. My window changed, so I wasn't sure what happened. Um, but we were, like I said, very upset and sad to lose Ellen Abbott, and you heard about her contributions to our criminal justice population. We wanted to make sure that we placed this memorial resolution at the top of the summary, so that you could see it. And
Hey,
I think,
Zach,
yes, ma'am.
I got kicked out and the link will not let me back in. So I'm having to finish up by audio. So
Oh,
I don't know if
no.
anybody else got kicked out or not. Said I had been dismissed.
Well, that's interesting that happened, Kirby.
I'm sorry. I don't know what happened. I didn't click on anything.
I've tried several times and I can't get back in. So I am on the phone.
Okay.
Sorry about that, Debbie. I'm not sure what happened there.
Just didn't want me on. That's what it was.
I did not push the button, I promise.
Okay.
So moving on to the bills that we have on this list, Senate Bill 753, House Bill 81 was the piece of legislation that our department proposed. Does several things, but the two things that I think this group would be interested in is it codified in statute the membership structure for the regional councils. Before this bill, the regional councils are not actually enumerated in state law, and there was some confusion. I guess Debbie's really upset with us today and doesn't want to listen or watch us.
I'm here. I'm back.
Oh, Debbie's back. Great. Technology's being difficult, isn't it?
It is.
So going back to the regional councils, this bill puts into state statute the requirement that the council strive to ensure that a majority of their membership is service recipients, former service recipients, or family members of service recipients. This was a bit of a point of confusion since the statewide council has this membership requirement, and it was unclear whether it filtered down to the regional councils. So we thought it was appropriate to clarify that, to make that clear for reviews once the comptroller starts looking at the council and at the department, that's very clear that the regional councils are going to strive to ensure that membership is like that, but they're not required in the same way that the statewide council. It also clarified that licensed alcohol and drug abuse counselors are authorized to provide and practice telehealth and telemedicine. There was some confusion with the board and with the previous telehealth legislation that we had back at the end of 2020. There was a little bit of confusion in the language, and we just wanted to make sure that was very clear. So Now, as state law is in its current form, it makes it very clear that alcohol and drug abuse counselors that are licensed in Tennessee are authorized to provide telehealth and telemedicine services.
As one of those, we thank you.
You're welcome. Yes, ma'am. I thought you would be interested in that.
Yeah.
Definitely. The bottom of page 2, Senate Bill 739, House Bill 73. This is the K-12 Mental Health Trust Fund bill. This was the bill that implemented the governor's initiative with the $250 million, creates the trust, and $225 million creates the corpus of the trust. It also creates an account where services can be funded. The initial deposit for that is 25 million, and then the state will receive the proceeds from that trust fund on an annual basis to be able to fund prevention, intervention, and mental health services for K-12 students. So obviously a very large investment, and we were really thankful that the legislature and the governor made that investment in the department to be able to use non-recurring funding to turn that into recurring funding and provide services through that funding. So we're really excited about that program moving forward. On page 4, Senate Bill 207, House Bill 215. This bill, excuse me, this bill is a pretty comprehensive bill related to recovery residences and credentialing for those. It does not require licensure for recovery residences, but it does require some recovery residences that want to receive referrals from certain sources to be certified by an organization or be funded by a state or federal entity. So I've encouraged everyone, if you are in the recovery residences business or provide that as part of the services that you provide, I would very much recommend that you review this bill and get familiar with those provisions there. Senate Bill 558, House Bill 1132. This is the Tennessee Opioid Abatement Act. This bill created the Opioid Abatement Council, which is an entity that will assist with the allocation of funding from the opioid lawsuits. You probably heard last week there was an announcement that there was a uh, tentative settlement with some of the opioid companies in a multi-state lawsuit, and then they're in the process of finalizing that. So this gives an idea of what the path should be once those funds start coming into the state. It creates the council for review of those funds and allocation of those funds between state government, local entities, and again, for the purpose of opioid abatement in Tennessee. Senate Bill 118, House Bill 490 creates the Medical Cannabis Commission. This does not legalize medical cannabis, but requires that commission to come up with a plan for action in the event that the federal government decides to reschedule marijuana out of Schedule 1. So, like I said, does not legalize medical cannabis, but is starting to move the wheels towards what will happen in Tennessee if marijuana were to schedule from Schedule 1. Another part of the bill increases to the amount of THC in certain cannabis substances for certain patients that have specific health conditions. So it moves that from 0.3 to 0.9, which is a decent change that decent, and I'm sorry, not making a policy decision, but decent in the number that happened or for the legalization of certain substances. So again, it's specific to certain people and certain health conditions and requires doctor notes and so on and so forth. So that's there for your review if you're interested in the latest on medical cannabis in Tennessee. Senate Bill 1265, House Bill 508. This bill allows unlicensed graduates and students to be able to practice telehealth and telemedicine for the purpose of getting their hours in a training program. obviously during COVID, we noticed that those students and pre-licensed workers were having trouble being able to get their hours for licensure because that in-person access to clinics and patients was not there. So this authorizes those practitioners who are working towards a licensure to be able to practice telehealth and telemedicine as long as they're under the supervision of a licensed professional. Moving on to page 8, first two bills on this page are sunset bills. The first will extend the Department of Mental Health and Substance Abuse Services for 4 years, and the second bill extends the Statewide Planning and Policy Council for 4 years. And I know those of you that are familiar with state government are aware of the review process every several years. The comptroller does a review on governmental entities, and then the legislature takes up legislation related to that entity to either begin the process of winding down or terminating that entity or extending it to continue doing its work. So we were very grateful that we got a full 4 years for both the department and for the council. Senate Bill 773, House Bill 779 at the bottom of the page. This bill was to try to capture any executive order provisions that state agencies needed in order to continue to deal with the pandemic as the state started getting away from executive orders and focusing on state laws. So most of the provisions in this bill deal with the Department of Labor. However, there is one section that was relevant to our department, which authorizes a transportation agent to receive an electronic copy of a certificate of need when a patient's being transported to a psychiatric hospital. So this bill, because of certain evaluations being conducted via telehealth or teleaudio and not in person, we were seeing that sometimes a paper version of the certificate of need wasn't being generated. So this just gives the flexibility to allow electronic copy of a certificate of need to be accepted in place of a hard copy. Moving on to page 10, Senate Bill 767, House Bill 784, and I'll combine this explanation with also Senate Bill 768, House Bill 785. These two pieces of legislation were the governor's criminal justice reform bills. The first bill related to community-based alternatives to incarceration, and certain provisions related to community corrections, probation, supervision. And then the second bill relates to reentry and planning for services for those that are incarcerated and are soon to be released or are being released currently. These two bills, I will not claim to be an expert at all on criminal justice reform. But these were very large pieces of legislation, comprehensive pieces of legislation this year that I'll encourage anyone that's interested in the criminal justice work to review. And like I said, unfortunately, I'm not an expert in criminal justice in any stretch of the imagination, but these were bills that were very important for the state during the legislative session this year. That is the last bill that I have on my list. I'm happy to answer any questions or if anyone wants to discuss a certain piece of legislation on here, happy to do that as well. Debbie, I think you're muted. Sorry.
I'm gonna mute. I'm sorry. Would you give your name, please? Oh, that may have just been my echo. Are there any questions for Zach? Kristen, welcome. We'll look forward to working with you. Oh, there's my guy, Clark. Are there any questions of Zach? All right. Zach, you and Christian, we both appreciate uh, the details that you give us the information back in. So thank you very much for that. Um, and we're glad you're taking some of the load off of Avis.
We're
We
we'll do
appreciate that.
anything that we can. Thank you, Debbie. We always.
All right.
Thank you, Debbie, for that comment, and
Yeah,
Zach.
you know, I'm trying to find some way to take some loads off of me. So whatever your secret is, send it to me.
I know you are, Debbie. I know you are.
All right. Kirby, we'll go to you for department updates.
Okay, sounds good. Let me pull this up here. All right. 1 second. Okay, can you all hear me?
Yes, ma'am.
Okay, so just a few updates since we last met in May. Debbie, I'll be sending, and Amber, I'll be sending out an email about this next week sometime, but I just wanted to have it all on your radar to please identify your region's key accomplishments achieved and challenges faced from July 1, 2020 through June 30th, 2021, and your region's future plans. Each year, a joint annual report is produced and delivered to the governor and state legislature to highlight accomplishments, challenges, and plans for the future. The joint annual report is a collaborative effort between our department, all 7 regional councils, and the statewide council. The information for the FY21 joint annual report should be sent to me via email no later than September 17th. And like I said, I'll be sending out an email about that as well. Year 3, FY22 of the 3-year plan is in progress. Regional councils will have an opportunity to review within the coming weeks. Development of the FY22 mental health block grant is also underway. Statewide and regional councils will have an opportunity to review soon. As we all know, the 2021 legislative summary is complete and it has been posted to the department website. I've included a link to where you can find it on the department website in my update, which I'll send to you via email after the meeting, Debbie.
Okay.
And last but not least, the department is releasing a new certification for peer support specialists designed specifically for young adults with lived experience of mental health and/or substance use challenges. The Certified Young Adult Peer Support Specialist program is tailored to young adults in both design and language with a target age range of 18 to 30 and a requirement of 1 year in recovery. The program includes a 1-week, 40-hour training session covering topics including responsibilities and expectations, strategic sharing, youth empowerment, positive youth development, the ladder of youth voice, and trauma-informed care. Through this training, specialists will gain the knowledge needed to provide youth and young adult friendly peer support to people under the age of 30. Peers certified through the program are also required to complete service hours and continuing education to maintain their certification. This program joins the department's current offerings in peer certification, the Certified Peer Recovery Specialist and the Certified Family Support Specialist. I've also included a link to our department website where you can gather more information about this new program as well. And that is what I have.
Any questions of Kirby? You guys are quiet today. All right. And Kirby, as you were talking, one thing came to mind. I'm so used to somebody else taking minutes, so somebody's going to have to help me pull minutes together because I just realized
you need a secretary.
I need a secretary.
Well, the good thing about this, Debbie, is that I've taken attendance for you.
I appreciate that.
You. And hey, we're a team. I'm here to help. And this meeting is being recorded, so it's helpful with the minutes and all that. But that does, yes, you do need a secretary. So
well, and actually, if you'll notice, that's the next item on the agenda. As you guys all know, for all the terms that I have served in this role, I've I've always been able to supply a secretary off of my staff that would attend meetings and get them out. And Kirby had to do a gentle reminder that I needed to get the agenda out the other day because Sherry took over and did all that. So I become accustomed to it. So I got lazy, I guess. But in all seriousness, this region needs a secretary. And within that, that is somebody who can work with me to get the agendas out, to set the agendas, and to then take the minutes. They also help me to monitor Kirby and Avis's emails that need to be forwarded out to the council. So I did notice, so that's the one thing, okay? I'd like to ask, would anyone volunteer for this?
I'm also here to answer any questions you might have about the position. We actually encountered this with 2 other councils this year. Jobs change and people they move or they're not able to do it anymore. So we went through this. So we've experienced this with 2 other councils this year. But I'm here to answer any questions. Like Debbie said, the secretary is, the backbone of the council and there to provide support to both the chair and vice chair and just to keep the councils informed of upcoming meetings and different things like that. But I'm also a huge support and can help you along the way. It's not like you're going to be going into this without any idea of what's going on. I'm here to offer support. So you won't be alone.
And
if
just
you
to
decide to
add,
volunteer.
sorry, Kirby, just to add to what Kirby just said as well, this is Avis. Kirby mentioned the 2 other regions that also had this issue with the secretary. I would like for you to know, and I want Region 5 to be in this number, that we did get a volunteer before the end of that meeting. So come on, somebody volunteer to help out Region 5 and help out Debbie, because the regional councils are very important to the work that we do in the department. So this secretary will serve on the executive team with Debbie, which consists of the chair, as you know, is Debbie, and then the vice chair, Amber, and then the secretary would also be a part of that executive team. So hopefully we'll get a volunteer. Just wanted to add that little bit to it.
The thing is, you already participate in the council. You're here, and while it is a commitment, and I don't know why many of you joined the council, but I'll tell you why. Well, my first reason for joining the council was Commissioner Betts said I needed to come, and that was even before we got truly emerged into the actual department. So she said, come, I went. But the other part is, as you guys well know, you get to know what's going on at the state level. You get to have a voice at the state level. And to me, as an individual, so as a provider, but also as a family member of an addict who overdosed and died at the age of 44, I need to make sure that this, the state is great. This is probably some of the best department that I've had over my 30 plus years of participating, has been the most open, entertaining to new ideas, and willingness to work with providers on the ground. But sometimes those of us on the ground have to remind them that's not going to work. That doesn't work out here on the ground level. And my experience with them has been they're open to out of the box ideas. They're open to hearing that maybe you think it's a dumb idea. I mean, I've been known to say that a few times. And that's okay because it was a safe ground. But to have an active role in the council and then to get to be a part of the executive part of the council is very rewarding. And so I don't know what else I can say about that, except I would like, so that's the one part. Okay. The second part to my things I had marked on my list over here today. So I'm coming back to the secretary part. I hadn't skipped over it. I hadn't forgot it. Okay. So just know that. But as I sit here and I look at the council, and the other night when I was putting the agenda together, we are short on our number of consumers that participate in the council. Now, I know through COVID, that's put a lot of different constraints on what we can and can't do. And, unfortunately, everybody began to get comfortable after the vaccination come out and so forth. And then I've already got more active cases than I did last year. So this thing's coming back and it's not going anywhere. So being able to do this through telehealth is a great thing. But I asked each of you, where and how can we engage some consumers on this council? So that's going to be one of my questions. And Kirby and Avis, I would ask you, how do other councils get consumers to participate in it?
Hi, Demi. So every council looks a little different, especially where their meetings are held. That's a big piece too. A lot of many of the councils, they hold their meetings in outpatient facilities where they can make it open to individuals that would want to join. They can advertise it there. I know in Region 1, for example, they hold theirs at Frontier Health, but it's at their corporate office. But what they have done is they've advertised this meeting to their local peer support centers, and they actually have it's like part of their day to come to these meetings and participate. They have staff members that will transport them there. So that's obvious. That's a different way of getting the news out, I guess I would say, to individuals, service recipients, but also family members of service recipients as well. I know with Region 4, the former chair, Robin Nobling, is no longer the chair there, but she worked through NAMI. So she was sharing this information and getting it, at NAMI meetings as well. So there's all different types of ways you can get the news out to service recipients and family members of service recipients. I hope that helps.
It does. And when you look at, so when we're here in Middle Tennessee, we go from the Kentucky border to the Alabama border, excluding Davidson County. That's a large geographical area, but we're not the only ones with a large geographical area.
Right, Region 3 is that way too.
Very large geographical area, and they go from the Kentucky line down to the Alabama-Mississippi line and over to Arkansas. So we're not the only ones with a large area to be served. I would like to ask and challenge each of you to try to find at least one consumer, and it can be the actual individual receiving the direct services, or as I don't remember if it was Kirby or Avis, a family member of someone, to challenge you to invite and bring one person to the next meeting.
Hey, Debbie,
Yes.
this is Clark.
Yes.
I always wondered, I'm part of the Winston County COC also, and why does we not have any participation from them on this region meeting here?
There's no
think-
there's no specific reason, Clark, and I will extend an invite to Ray and them to
Yeah,
participate.
but I think she would love to become a part of it.
Okay.
And so you say you will invite her, or I can mention it.
You can, but I will do a follow up with her on that. But if you will do the first reach out, I would appreciate that.
Okay, I will.
Okay.
Also, Debbie, this is Avis. In addition to anyone that is on the call, if you know anyone from your agencies that may even work there or receive services through the agencies is one way. Debbie, Office of Consumer Affairs as well has the, that may be another avenue through Lisa Reagan, as they hold their CAB meetings monthly. We do have a representative on our statewide council or CAB, but that's another means that could be suggested or offered in their meetings, if anyone would be interested in joining the Region 5 Council. Maybe another avenue as well as Kirby mentioned, NAMI is a good source. Go ahead, Debbie.
I remember through the years the conversation, and as I was sitting here, so I have a specific program. It's called peer to peer.
Right.
I call it my down and dirty 12-step thumping program. Okay. And it's peer driven. Peers run it. There's no licensed people there. Now, I actually oversee it, but I don't have involvement in it on a daily basis. But when I even look at those, so okay, maybe I can get a couple of those to participate. So I've actually written down peer to peer here. The other thing that come to mind as Rebecca was talking is reaching out to some of the recovery courts and trying to get some involvement from them. And I will work with Rebecca on some of the to look at some of the recovery courts.
Also, TADS maybe, I don't know, some SA members. That may be a possibility. Not sure, but something to maybe think about, Mary Linden, through that avenue.
Laura, can I ask you a question? Are you still with us? There you are. I see your name.
Yes.
I know you're with the Cheatham County Coalition. And we also have another lady, and her name escapes me, Murray County. What's her name?
Kimberly Ladd.
I'm sorry, Kimberly.
Kimberly Ladd.
Okay, thank you. So how many coalitions do we actually have in Region 5?
Several, probably at least 5 or 6. And I think we've had this conversation before. I mean, when we used to meet in person. And it sounds to me like it's a matter of marketing for participation in this meeting, not only with the coalitions, but I know that you mentioned, and lots of us employ peer specialists.
Mm-hmm.
And those are certainly consumers that might be willing and excited to be a part of this council. I believe it's our marketing is where we kind of fall short. As far as TATUS, I mean, our TATUS members are like Debbie and her agency. We could market it to the TATUS members in this region. Debbie, I think that's a good idea.
Okay. I would like to, if I could, so I'm going to specifically challenge Laura and Kimberly to see if you could get at least one more coalition to participate, maybe more, but my challenge is one with regard to that. And let's see, what else did and I had the peer centers down on my list.
Debbie,
yes.
I can add one more thing regarding the coalitions. I will certainly announce it, but we have an annual provider meeting for coalitions. That meeting is happening, I believe it's next week on August the 13th. And if we could get Tony Jackson or somebody from the office that funds these coalitions to mention it, or if Kirby could send something, that might be a great way to get the word out. These are all the coalitions across the state, not just in our region.
That's awesome. I'll reach out to Tony, but if you or Kimberly or even Avis and Kirby could just do a follow-up, that would be awesome. You know, we've had the lifeliners and we've had the ropes people, and we specifically, I remember we were in the old TATUS conference room asking them to come every quarter and participate. And I'll reach back out to the name's running past me, out of Winchester, Alan Burnett.
Yes, so, you're right, Debbie. We did do that in the past. The name is familiar to me that you just mentioned. So yes, we have done that, but refresher might help as well.
All right. And it may be that I just reach out to Monty, because I think they work under him or work with him, is to for the same way that Laura said, reach out to Tony, because these are positions that are funded by the department. Help us to help the community. So Laura, I don't disagree with you. I think it is a marketing issue. But my challenge, at least going into next quarter, reach out, find somebody. It may, Clark, I know you're active in your church. It may be getting a church involved. It may be Clark getting, only because it's the name I can think of, Larry McKnight, a veteran. Mm-hmm. who is a family member, but he's also someone who has served our country. Right. So I can come up with all kinds of names, but guys, I have to tell you, this is not a one-man band. I cannot do this without having all of you to help me. And I need that. I want us to be able to start trying to look at doing some projects and doing some things. And I can't do it. You know, and it's your participation is being strongly asked to help. Because one of the other things that, as I was making notes the other day, I think about this stuff at 1 o'clock in the morning when I can't sleep, is We've got Recovery Month coming up next month. We just heard about our recovery courts in our region. I am sure the coalitions are doing something. But is there something that we could do for Region 5 that says Region 5 on it, and that we get it out promoting Recovery Month? But it can't be me thinking up the ideas.
Debbie, are you talking about like a flyer to advertise Region 5?
Kinda, I think. And
I made something like that a couple years ago, and I shared it, but I don't think anybody really took
would
to
you
it.
resend it, please?
Yeah.
But it would, something just to the fact, because I'm sure a lot of people, and maybe it goes to the county mayors and the city mayors, and maybe it goes to, like following this call, I have another Zoom with the Wayne County Care Group, the children's department down there. They saw my bus. They wanted to know more about my bus. And so being able to get some, hey, September's Recovery Month. Reach out to those who are in recovery, support them, I don't know, something. But then it's just something that Region 5 is getting out to its community. It's just an idea. I can throw ideas out all day long, but I need help making them go further.
Also, Debbie, sorry, were you gonna finish saying something?
No, ma'am, you go for it.
Also, as of course we're meeting virtually now, all totally virtually due to the pandemic. Don't know how that's going to shake down going forward, but also continue to offer whenever we start meeting back in person, kind of a hybrid model for those, a hybrid meeting rather, for those who may not be able to attend in person, because Region 5 is a little different because of the counties that are spread out so kind of far apart, different than being, like Davidson, of course. So if folks could not come in person to Titus or wherever that meeting location is, often the hybrid. We've done that before, and we did have a few participants over the phone, but that may have had shifted once we stopped meeting in person. But considering continuing that hybrid model when we do go back in person, for those who are not able to travel, may be helpful too.
I totally agree. I know. I jokingly laughed yesterday. I got to get dressed in a full suit and go out of my house and go do some stuff. I was so excited. It was like a kid in a candy store, to be able to get back out where people were, and this, that, and the other. But we've, all of us, because of COVID, have become pretty isolated. I mean, I live back here in this little hole, and but I think being able to start having a true mixture of even if you can't come, here's the video link. You can video in. And we've learned that people can do that because we see it every day being done on Zoom calls. I didn't mean to get on a soapbox, but I am asking for your help and support for Region 5. I am. I don't know how else to put that. Region 5 needs a secretary. It needs to be somebody that is out in our region, that is or going to be or will be participating in this council. We need some chairs for some committees. So I guess this meeting for me is a plea for help. That's just me. Those of you know me, I just put it on the line. So I've said what my needs are. And I still need a secretary. Is there anything to report on the coalitions, Laura?
Well, we are busy with preparing for August 31st for the International Overdose Awareness Day.
Wait a minute, it's what? Overdose?
International Overdose Awareness Day is August 31st.
All right, so what's going to be happening there and where is this?
Well, now this is an international day. The department has developed, I believe, a website for everybody to enter their activities, much like we do for Recovery Month on the treatment side. What we are doing in Cheatham County is we're having on the courthouse lawn a remembrance celebration of, for families that have lost people to overdose. We had this 2 years ago at Christmas, and then COVID, we couldn't have anything in person, but we have a speaker that has lost a family member and another speaker that's been revived with Narcan. And we have our local faith community involved, they will be there. But there's various celebrations going on among the coalitions. The department has every coalition making a video that they will share on their website and through their social medias. It's a 15-second video saying that actually our ropes made ours and talks about what she does and why she does it in 15 seconds. As I mentioned, the annual coalition provider meeting is next week, and it is an in-person, hybrid, online combination type meeting. The coalitions were just funded with some of the SOR2 grant money to be able to start working on stimulants. Coalitions are funded through the state office to work on 3 specific substances, which were alcohol, underage tobacco use, and prescription drug misuse. Now with this new money, we're able to add stimulants to work on that. And that's about all I have from the coalition world.
Okay. Is Kimberly on here? Okay. Do we have any idea, Laura, for what like maybe Murray County is doing?
I don't, Debbie. I haven't heard what they're doing. I do know because I employ a ropes and I'm on some email correspondence. The ropes in the area that covers Wilson, Williamson, Rutherford, they're setting a booth up at the Wilson County Fair to promote the Narcan training. And actually have a booth to do training. And they have asked all the other ropes around the state if they could participate and take a shift. And I believe that fair starts 3rd week of August.
Okay.
So that's about all the activities that I know of. But Kate Faulkner works under Tony Jackson now as the program manager for the ropes program, and she has been collecting a lot of this information, so she would be a good one to give an update maybe if we wanted to look at having her on the agenda next time.
What was her name?
It's Kate Faulkner.
Okay. You know, it's one of those things. We've always said for years, and again, I'm dating myself, that A&D and mental health operate in silos. And over the years, we've done really well to knock those barriers down, especially when we become a part of the department and the name, there was equal recognition for the name. So kudos to the commissioners that did that and the staff that made that happen. But what I still see on some level is still some silos. And the fact that all of this is going on out in our region, and we as a council don't know it. Maybe if we knew some of this, we could offer some kind of support, even if it's just, hey, you got it, you know, encouragement, whatever it may be. But you know, I'd like, you know, so that's why I asked you, Laura, you know, what were you doing? What did you know what Maury County was doing? What's another, can you give me another coalition in South Central Tennessee?
Oh, yeah, there's, Lawrence has one that's very active, Franklin, Coffee.
Is there an easy place to go get a list of the coalitions?
In theory, that would be the Prevention Alliance of Tennessee. It's called PAT, P-A-T. They have a website, and they just got a new director, which is Stephanie Strutner. She's formerly the executive director of Anderson County Coalition. And I believe they have a list of coalitions and contact information, as well as the department has that on their website.
Hi, Debbie. I'm putting the link in, it's on the department website. I'm putting
Okay.
the link in the chat box.
Oh, okay.
And it has all of the coalitions throughout the state.
All right.
And the contact.
I see it. Yeah, I see it there. I'll copy it and then put it over here and open it up after the meeting. I think it's just, I just think it's important that we know what's going on. We cannot help Commissioner in her role if we don't know what is going on. And I think that's a key part. And I will say shame on me because I don't know a lot of that. I know enough to be dangerous, but I'd like to see more involvement. I'd like to see some more ideas regarding coalitions. And I actually wrote down over here the Prevention Alliance of Tennessee. Maybe, and I forgot what you said her name was, Laura, the new director, but maybe get her to be our speaker at the next meeting to talk with us about these alliances and what they're doing down in those areas. And because I know they do needs assessments, and Lord knows we have to do that starting in January. Okay. They're on the front lines, and we need them, and we got to figure out how to get them. So I'm off my soapbox. I think I reserve the right to come back to it though. I'm still looking for a secretary. And it was either Avis or Kirby who put out that challenge a while ago that the others had one before their meeting ended. So I'm going to put that back out there. While you're contemplating that, are there any announcements from anyone? And they say, not after you. All right. Is there anything else that needs to be brought before this group?
Debbie,
Yes.
this is Wendy Sullivan. I'm newly with NAMI Tennessee, and I feel like if I get a some kind of invite, I can send that out to my affiliates, which are groups of consumers and family members of consumers, and maybe we can get some people from there to join our meeting.
Okay. Wendy, are you on the distribution list?
I'm not.
All right. Let me give you, I'm going to put my email in the chat box. Okay.
Okay.
And if you can send me your email so that I can get you on the distribution list. Okay.
Okay. Sounds
So I
good.
just sent my email out to everyone. The other thing that I did notice was the distribution list that Sherry gave me. A lot of those, and I sent you an attachment when I sent the minutes out, asking you to look at the roster to see, are there any changes? Because I got a lot of them. I got a great number of them kicked back to me. And you know, we need to make sure that we have good, solid email addresses. So if you've not, and I'm guilty of it, I'll own my stuff, I'm guilty, is if you would take the time and look at that Excel spreadsheet that's got a roster on it, try to help me to update that. Make sure, first of all, your information is correct, and look to see if somebody else's is correct. And the other thing, if they're on that roster, how about making sure they join us for our meetings? So again, I'm full of challenges today, so that's another one. Amber, I'd like to get with you and Kirby and anybody else that wants to, but specifically you guys, to relook at the structure of the actual meeting. What brings value to everyone to come to a meeting? What is it for each of you? What is it you need from these meetings? Okay, that's one. Two, are you getting it? And if not, how can that be improved? I'm having to write my notes over here so I don't forget it. Okay. So there's a lot of challenges out there. And so it says Ramona no longer has access. Oh, okay. I appreciate your time this morning. I'm very sincere with my plea. And I do challenge you. This is not Debbie's counsel. It's your counsel. And Commissioner needs to know what we need in our rural counties, because what we need in our rural counties is not what Nashville needs in its county. So, is there any other business? The Avis, Kirby, Zach, y'all have anything else?
I do not.
Amber, do you have anything?
I'm good.
Okay.
I do not, Debbie, but I sent you an email, so if you want to check that out quickly.
Well, I can't figure out what I did, but I can't figure out what the question.
In reference to what you just asked, for Amber and Kirby, maybe pose that to the members,
Okay, so
yeah.
So what she's referring, I've learned a long time ago in working with the state. Sometimes there's a way to ask the question, and then I ask the question, and I'm thinking. Then I'm a reflective person, so I'll reflect back and say, "Was that okay? Whatever." So I sent Kirby and Avis when I was doing my pleading. Was what I asked, what I said, was that okay? Because I am respectful that there is a protocol. I'm respectful of the fact that this position that I sit in is an honor. I view it as an honor. I'll tell you, I do. And I love doing it. But my question was, is what I said okay? And Ava sent me a text back and she said, ask the members that. So is what I said okay? And I'm a big girl, so I can take criticism. I don't have a problem with that.
Okay to me, I'm used to it.
Clark and I have a long relationship, for those of you who don't know. And I love you too, Clark.
Also too, Debbie, just to see maybe what the members would like to see or like to have on the agenda, what they want to see in these meetings going forward that's going to be beneficial to them and in the capacity they work and the individuals they serve, whether that is presentations, resources, agenda topics for adult and children, both with mental health and substance use disorders. What do they want to see? And I say that because sometimes when the chair, even on the executive team of the council, are trying to decide what agenda topics they want for the next meeting, there may be some ideas that you have, but getting the members to send you emails or at that meeting, the previous meeting, identify any topics, resources, discussions they want to hear based on what they're doing in their community, the work they're doing, because sometimes we find that even still with COVID, it's even challenging. And as you mentioned earlier about the rise in the variants, that's going to be challenging. for everyone, providers, advocates, consumers, family members. So sharing how you deal with certain situations, programs and services is going to be important, really important going forward. So some of those things may be helpful with members if they have any ideas.
You know, and you're 100% correct, and that's what part of my challenge today is to everyone. But most of y'all know I never have a problem telling you what I need, even as a provider. And I can tell you, as a provider right now, so in the last month, 2, 3, 4, 5, 6, 7. In the last month, I've had 7 active COVID, 1 staff, and I guess then 6 clients. I can tell you, as a provider, I feel like I'm hanging out here on a limb trying to figure out the dilemma of keeping an agency open while trying to follow the CDC guidelines and trying to keep my staff and my clients as safe as possible, taking my buildings and trying to set them up in zones. The red zone, your yellow zone, that's the red is you got it, yellow is you've been exposed, and then trying to do that contact tracing with somebody within 6 feet for 15 minutes or longer during a 24-hour time period, and then figuring out how to quarantine them while still taking admissions, because people are dying on the streets and I can't shut the doors. So I can tell you, as a provider in this region, I would love some ideas about how to do this. It's hard with this COVID stuff. I mean, it's hard every day because we're dealing with people whose lives are dying. But then you throw COVID on top of it. You know, how are others dealing with COVID? I know a lot of providers who've just closed the door, says, we ain't doing this. Buffalo Valley didn't see that as an option. But there are days like yesterday and even still today, because I still got to finish all that other stuff. I feel like we're hanging out there on a limb. Now, I'm fortunate. I will totally give credit, and it's not because they're on this call. I couldn't have kept my doors open without the guidance and the assistance from the department, and even them connecting me to direct individuals at the Department of Health who came out to my facility last week in Nashville, the detox center, and helped walk me through how to zone out my building while still taking admissions, but while protecting the active case and those that needed to be quarantined. And if you're not running a facility, I'm telling you, this is scary crap. And Heather, I just can't say enough about Heather. I called her on, I texted her on Saturday night and says, yeah, I got an active one in detox Monday morning. I had rapid tests. I had more gloves. I had more of everything. And she was Johnny on the spot for me. And she chased down the person at the Department of Health. So the department has been great, but just everyday stuff, guys, it's tough. All right, so that's my soapbox. Is there any other business to be brought before this committee, this council? If not, I'll entertain a motion to adjourn. I still need my secretary.
Motion to adjourn.
Thank you, Clark. Is there a second?
Yes, I second it, Rama Mohammed.
Thank you. All in favor signify by saying aye.
Hi.
And as I would normally say, if it was in person, vote with your feet. Be, Clark likes that. Be safe, people.
Bye, all.
Bye,
And-
everyone.
Bye, you guys.
Thanks,
All right,
Debbie.
bye-bye.
Bye.
Bye-bye.